So, welcome everyone, and thank you so much for joining us for this Diabetes Action Canada webinar presented by the Knowledge Mobilization and Implementation Science Program. My name is Julie Makarski, and I am the co-lead of the program at Diabetes Action Canada, along with Dr. Monica Kastner, who is the scientific lead of the program. Monica is also the research chair of Knowledge Mobilization and Implementation at North York General Hospital. She is an associate professor at the Institute of Health Policy, Management and Evaluation and the Department of Family and Community Medicine at the University of Toronto. Monica's presentation today will aim to demystify or simplify the what, why, and how of knowledge mobilization and implementation science theories, models, and frameworks. We know that this is a topic of interest to many, and so we are very pleased to offer this webinar. Also, in considering that many of you may have questions on this topic, Monica has designed her presentation to allow for a 15-minute Q&A period at the end. So before I turn it over to Monica, I would just like to briefly mention 3 housekeeping items. First, we are recording today's webinar, and it will be available on the DAC website and will include a French language script. Second, for the Q&A portion at the end of Monica's presentation, please feel free to raise your hand or type your question in the chat. We'll also be emailing a Q&A document to all webinar registrants after today's webinar. And lastly, we hope you'll take a few minutes to answer a brief survey at the end of the webinar to share your feedback and suggestions for future webinar topics. I'll include a link to the survey in the chat. Thanks so much for your attention. And with that, I will turn it over to Monica.
Great. Thank you so much for the introductions, Julie, and good afternoon, everyone, and thank you so much for joining this webinar. Today, I'm very happy to describe to you a presentation dedicated to selecting and using knowledge mobilization and implementation theories, models, and frameworks in research. And our objectives today will be to actually define what these knowledge mobilization and implementation science theories, models, and frameworks are, to describe how to select them and when to use them, and to
Oh, it appears that Monica's frozen, but she should be back in. She's been having some issues. Sorry about that.
What are these knowledge mobilization and implementation science theories, models, and frameworks? And don't get alarmed too much about this slide. I know it's a lot. I'm only going to describe just very briefly what these theories, models, and frameworks are. And I'm hoping that this slide will help you or provide as a resource whenever you're trying to think through what they are and what kind of theories and models and frameworks you might want to consider as part of your project. So let's start with theories. So theories typically clarify a phenomenon. They provide an explanation, and it's really used to develop and test hypotheses. And the really big difference between theories and models and frameworks is that they actually are explaining things. It's an explanatory type of activity, whereas models actually show how things work. So it's the operationalization of a phenomenon. They simplify things aimed at increasing understanding, and it's able to guide steps, processes, and flows of implementation. In terms of frameworks, they show you actually what to do, and they help with decision making, and they provide a structural representation of things. And the key difference here is the fact that it can actually lead to decision making. That's the big difference between models and frameworks. And so again, I'm not going to get into the other pieces, but this table will provide you with some key features. Those are relevant for knowledge mobilization and implementation science, the differences in relationships between the three, and some types of theories, models, and frameworks in each of those categories. And again, this is not an exhaustive list, but it's just meant to show you some of the common ones. So how should we consider TMFs in research? And I'm going to call them TMFs most of the time, so I don't have to say the actual terms. But the way I think about it is that they are used as tools to help plan, to predict, to guide, or evaluate the process of implementing evidence into practice. and to enhance the quality of the research that we do related to implementation science. Because we know that theory-based interventions are more methodologically rigorous, they're more valid, and have a better potential for impact. And they can increase the likelihood of successful implementation and sustainability. We also use TMFs to understand factors that influence the implementation of the evidence in particular healthcare settings, to identify those determinants, which are the facilitators or enablers and the barriers and challenges that can influence research outcomes. And we also use them to support the successful spread and scale of effective interventions, programs, or knowledge products. And finally, TMFs help us to evaluate all of our activities related to implementation. So one thing I want you to walk away with is that there is a lot of confusion around theories, models, and frameworks, and they're not perfect. There are, we struggle with how to use them. We struggle with, using every part of the framework or model. But what I think the way you should think about it is how it can help you to do what you intend to do. So just always keep that in mind, that they're not perfect, but they are useful. So let's get into how we can really select knowledge mobilization and implementation theories, models, and frameworks. So there are challenges to selecting, as you can imagine. I'm sure all of you have experienced this. There's way too many. So there's been over 150 that have been identified in the literature. Some very recent reviews have shown and consistently shown almost an exponential growth in the number of theories, models, and frameworks. The guidance is often limited on how to select them. There's a few strategies that I'm going to describe to you. And we often have a haphazard kind of way of doing it, where we select the ones that are familiar, the prior exposure we've had from it, something that's out of convenience, or we've heard about them, so we use them. But so the selection should be based on the aim of the research and the stage and level that the implementation is being investigated. And of course, always to think about the most effective strategies and the most evidence-based strategies in terms of selection. And it's not always used appropriately. So even though there's an outline of how you should be using it, it's not often used appropriately. There's poor reporting in terms of how we justify our selection of particular theories, models, and frameworks. And a big problem is the inconsistent language that's used across TMFs, even though a lot of them are based on classic theories and models. The language still tends to be very inconsistent, which contributes to this selection problem. The most common uses of TMFs are to inform planning, design, implementation, and evaluation activities, and there's less studies that have been looking at sustainability and scalability TMFs, for example, which is important, and it's increasing, but I think it's still lacking compared to, let's say, implementation and dissemination. So Nielsen's taxonomy of theories, models, and frameworks, I think, revolutionized the way that we think about theories, models, and frameworks in general, but in particular, how we might think about selecting them. And I think this has really been a game changer in terms of thinking through how we might logically select something. So I created an adaptation of this, and mainly for my own use and my students, just to try and clarify that process. And really, it boils down to three questions that you would ask yourself if you're looking to select a theory, model, and framework. Am I looking to describe the process of knowledge uptake? Do I want to understand what influences implementation outcomes? Or am I trying to evaluate implementation? And depending on the answers to those questions, then you can start to think through the flow of that particular question, and then start to think about which theories and models and frameworks you might want to consider. The other challenge is that some of these theories, models, and frameworks that I will describe to you and that are listed here overlap. So some of them can be a determinant framework. Some of them could be an evaluation framework. So there is that overlap because some of them have multiple uses. So keep that in mind as well when you're selecting them. Another strategy that's pretty good in terms of figuring things out and selection is the TCAS tool. And this tool is really aimed at when you're struggling with selecting um, between a TMFs that have the same purpose. So let's say determinant frameworks. So you've narrowed it down to two and you're not sure which one to use. The TCAS tool is very useful tool to be able for you to do that. And again, don't focus too much on the diagrams here. I know they're very small, but the idea is really to narrow down to two theories, models, and frameworks, and then go through this process of looking at these factors like usability of that theory, model, and framework, its testability, applicability, acceptability. Go through this process and you can score them. And at the end, you should have a fairly clear answer of which one might be relevant to what you want to do. And what this does is really promotes this deliberate rationale for selecting of TMFs, which I mentioned before is often lacking in the way we report the use of TMFs. Another really useful tool is this dissemination and implementation web tool that was developed by the Dissemination and Implementation Program in the United States. And it's a really useful web tool that has all these tabs on the bottom that you can see in terms of planning, selecting, combining, adapting, using, assessing different theories, models, and framework. And it's quite useful in terms of figuring that piece out. So I invite you to try and use any of these strategies that I mentioned. So now let's get into the next section that I wanted to discuss, and that is the how. So how do we use theories, models, and frameworks? And I'm going to describe each of those three different ones, the process models, the determinant frameworks, and then the evaluation frameworks. So let's start with the process models. So first of all, what are they? So the purpose of process models are to deliberately bring about change. And the reason I say deliberately is because this is in contrast to some of our classic theories like the diffusion of innovation theory that are not deliberately trying to, they just explain those changes, but they don't deliberately bring out change. And that's the big difference. They also help us guide how implementation should be planned, organized, scheduled. They specify the steps, stages, phases in the process, including the implementation and use of research. So how these can be used is to actually plan and execute implementation or to facilitate implementation. And many of them can help you to plan a body of research, including your funding structure, for example. So again, as I mentioned, there's many different ones that are available for use. And so these are just some examples of common ones. But I will dig into one particular one, the knowledge to action model, as one example to highlight how this can be done. So the knowledge to action model is an iterative and dynamic, it includes iterative and dynamic steps to deliberately cause change. It emphasizes the need to involve all relevant knowledge and users in the entire process, and that's what we call integrated KT. And the knowledge creation funnel, which is in the center of this model, the idea behind this is to distill the knowledge to the most usable form to then inform decision making. So the further down you go in that funnel, the more usable the knowledge becomes. So for example, I'll provide the example in a second. And then the outer section of this model, which is the action cycle, is where we can actually make change happen. So it includes a range of activities that are needed for the implementation of knowledge. And the goal is to apply and use the knowledge that's created. And the main thing about this is, and you can probably see that the arrows go both ways, meaning that there is no specific order to this. I mean, it implies a sequential order, but it doesn't have to be used that way. You can jump into any of those action steps anytime, whatever is relevant to your particular project. So the KTA model is very useful to plan, to guide knowledge mobilization and implementation, to plan a body of research. I used it for my PhD project and beyond. You can plan your resources and funding for your grants. So it's a really useful way of planning things out. So just a few words around integrated KT. I just touched upon it briefly. And we also call it co-production of knowledge and why this is important. So this means an integrated KT or a team that's called integrated KT team means that this active engagement of all knowledge users as partners right from the beginning of the research project leads to more actionable research results, so that can increase uptake. And I should just very briefly mention that when we talk about knowledge users, those are the people that will actually use the research results or they're interested in the research results. So they're very important in this process. And the results become more relevant and used by knowledge users when we engage all of those relevant people around the table. It leads to stronger science that can have a better potential for improved outcomes. It can sustain patient outcomes in key stakeholder relationships. And I have witnessed that firsthand in my own work. It can promote the trust and that shared vision because you have that collaboration and you reveal those different perspectives, expectations, and values. So you build that relationship that becomes a trustworthy and collaborative relationship. And IKT is ultimately fundamental to successful implementation and should be embedded in the research process. So that's all I'll say about that. And now I just want to walk you through an example of how you might apply the KTA model. So KeepWell is a tool that we developed through my program of research. And it was basically born out of the problem that still persists today, which is that, a lot of older adults, more than half, have multiple chronic conditions such as diabetes plus arthritis, for example. And at the time that we started this project, it was relatively unknown what interventions exist that can address multiple chronic conditions. So that's how the problem started. And so what we did was to then go into the knowledge creation funnel of this knowledge to action model. And this is where you can often think about this as being the base unit of any sort of knowledge mobilization or implementation activity that you're going to do. So typically what we do is, we can consider theories, models, and frameworks in the knowledge synthesis piece. So in our example for the KeepWell project, we conducted a systematic review to really identify those those interventions that address multiple chronic conditions. And then we also did another type of review that just unpacked the reasons why those interventions work, for whom and under what circumstances and contexts. So you can use theories, models, and frameworks to then make sense of that knowledge synthesis data. So how do we organize all of those interventions? How do we organize, like, the underlying mechanisms behind those interventions? And the theories, models, and frameworks can actually help us do that. So then the next stage in this funnel is to actually develop your innovation. So for us, we developed the KeepWell tool prototype, which is a web-based tool. We used the results from our knowledge synthesis. We also had input from our IKT, and I apologize, there's a spelling error there, of our integrated KT team consisting of older adults, primary care clinicians, technology developers to actually create this prototype. So then the next step is really in this model is to then go into the action cycle and figure out what is your next step to make that innovation, that whatever it is that you created, the knowledge, to then what is the next step to making sure that we can implement this in the most optimized way. So one of the really most important stages of the KTA model is assessing the barriers and facilitators to knowledge use. And at this stage of the model, theories, models, and frameworks embedded within this model can be used to design our interview guides. So if you did a qualitative study or survey questions in a quantitative study. You can assess the implementability or sustainability of your intervention, program, tool, policy. You can assess the readiness for implementation or scale up. You can organize and interpret your data. You can create outputs such as taxonomies, recommendations. And so there's lots of different determinant frameworks that you can actually use to make all of those activities happen. So in terms of our KeepWell example, we conducted a qualitative studies of interviews. We used the theoretical domains framework to create the interview guide, which I'll describe in a moment. We could have also used other frameworks, so that's not the only one to think about. And then we used our results of this qualitative study to then make adjustments to our KeepWell tool. So then the next stage is really around, there's other stages there, and I'm not going to touch upon all of them, but for us, it was very important to monitor and evaluate the implementation of the KeepWell tool. And so evaluation theories, models, and frameworks are very useful for us to identify implementation outcomes. So what kind of outcomes should we be considering when we're evaluating whatever innovation or program that we're trying to implement? And also to make sense of our results. In our case, we did a pilot study, including a usability study with 17 older adults. We also did a hybrid effectiveness implementation, randomized controlled trial to assess patient and implementation outcomes. And for us, we used the REAIM and Proctor frameworks to identify implementation outcomes for the trial. And I'm going to describe that to you in a moment. But again, like before, you can consider other theories, models, and frameworks for that purpose. So that kind of concludes an example of the process models. Now I wanted to dig into determinant frameworks. So what are they? So the purpose of determinant frameworks, and I've already alluded to this in my description of the KeepWell trial, is the overarching aim is to understand, explain, or assess the influences on implementation. So why and how people perceive the implementation of an innovation, how context influences implementation. Then you can also evaluate the variables of success with that barriers and enablers assessment. So what is it that's actually influencing the implementation? And then context, as you can imagine, is a very important part of this, because we need to also understand our context to be able to assess whether implementation is possible or not. So determinant frameworks, again, I alluded to how it can be used to the KeepWell example. It's really to help you develop data gathering tools. So what are they? So these are the tools that you will use to gather data on whatever it is that you're trying to understand. So the goal is to elicit the kind of response from your participants that will actually reveal those implementation barriers and enablers. So in interview guides for qualitative review, interviews and focus groups, and to use them to derive your survey questions in quantitative surveys. These kinds of determinant frameworks can also help you to organize, analyze, or make sense of data. So again, like what I described before about qualitative data or knowledge synthesis studies, you can actually map the themes to determinant framework constructs. Again, I'm going to describe that in a few minutes. And then lastly, we can also help it to inform decision-making, to actually generate recommendations using those theories, models, and frameworks. And I know I'm dumping a lot of information on you, but I'm hoping that the examples will clarify a lot of these concepts. And again, having this in your toolbox, all these different slides, hopefully will help you when you embark on your own projects. So some examples, again, for determinant frameworks are listed there, and I'm going to focus in on the theoretical domains framework and the consolidated framework for implementation research, or CIFR. And the main difference between these two is that the TDF focuses on behavior change, and the CIFR provides a broader context which plays a bigger role in this, in looking at the inner outer setting of your implementation, the processes involved, the innovation, and the people involved. So let's take an example of the theoretical domains framework, just to kind of walk you through it. Like, what do we mean by using the theoretical domains framework? So here I have a table that shows the 14 constructs, and these were found using a knowledge synthesis of 128 constructs from behavior change literature to derive these 14 constructs that have been associated with successful implementation. And so the way I'm going to describe this to you is an example scenario of a project that we did with Sunnybrook Hospital, who came to us and they said, you know, we're developing this new surgical scheduling system in our elective surgery unit, and we just really want to understand the implementability of this system. So as a first step to this, I suggested that we need to identify the determinants, the barriers and enablers of implementing this new system. So we conducted a qualitative studies of interviews with healthcare providers and clinic staff, so everyone who will be using the new system, to figure this out. So the interview guide of our qualitative study was then developed using the TDF by looking at these 14 constructs and formulating questions. So let's take the first domain, which is knowledge. So TDF defines knowledge as an awareness of the existence of something. So the condition, the scientific rationale, procedural knowledge, knowledge of task environment, all of those different things. And then we're going to set out and see how we can formulate potential interview questions from this. So this is what we came up with. So what do you know? This is what we would be asking our participants. What do you know about the new surgical scheduling system, and how do you understand it to work? That could be our first question. And how do you currently schedule surgery? So this will really get at that knowledge. So the second one, and don't worry, I'm not going to go through all 14. I'm only going to illustrate the first two domains just to give you an idea of how this works. So in terms of the skills domain, this is defined as an ability or proficiency acquired through practice. And this can include skills development, competence, ability, interpersonal skills, practice, skill assessment, all of these types of things. So again, we started to think about what the questions would be. How easy or difficult is it to schedule surgeries right now? What skills do you think will be needed to use? And how do you think the new schedule system will change things? And another way you can look at this, let's say the scheduling system has already been implemented, and now you're setting out to see whether it is actually how it's been implemented. You can change these questions in that way. So you can say, how easy or difficult was it to schedule surgeries with this new system? How do you think this new system actually changed things? So you can adapt your questions based on where you are at that stage of implementation. So then you've created this great list of barriers, you mapped into the TDF. Now what happens? What do we do with that? So the goal is now to come up with a way of matching those barriers with strategies that will actually directly address them. So these are some of the barriers we identified. So lack of knowledge of how to use the new surgical scheduling system was one barrier we identified, and this was mapped to the knowledge and skills domain of TDF. So then a potential strategy could be an educational session with providers and clinic staff. Lack of buy-in from clinic staff to use the new system, which was mapped to the beliefs and consequences domain as well as the social influences domain. So what would be a potential strategy for that? Having a champion to show the benefits of the new system, addressing any concerns expressed by clinic staff could potentially be solutions. So how do we come up with these potential strategies? So one way of doing that is to get together with your IKT team, discuss these solutions. Another way is to go into the literature and find evidence-based strategies that will directly address those. I will describe another tool shortly that actually helps with that kind of identifying these kinds of strategies as well. So let's get to that second example then. which is the Consolidated Framework for Implementation Research, or CFIR. And again, don't worry about that. I know this is a very busy picture, but it actually is a really interesting and very important framework that allows you to look at all these different contextual factors of implementation. And it was updated in 2022. It started with 39 constructs. It now has 44 across these 5 domains. And that's really all I want you to take away from this diagram, is those 5 domains. So looking at the inner outer setting of implementation, the individuals, the process involved, the implementation process involved, and the actual thing, the innovation that we're looking at. And that's what the CFIR does. It allows you to develop data collection approaches, interview guides, code books, things like that, to actually develop an intervention, to guide analyzing, interpreting, or reporting on implementation, and to link facilitators and barriers of implementation to outcomes. Another really great framework is the ERIC tool. It stands for Expert Recommendations for Implementation Change. And this gets at that idea that I just described with the TDF, where they actually compiled a list of strategies, 73 of them. That's why the picture there, the screenshot there is not meant for you to actually read it, but it just shows those 73 strategies that can directly address CFIR barriers. So this is a very interesting tool. It was developed to help stakeholders considering their planning for implementation by having a set of strategies already ready to go that could be matched with a CFIR barrier, similar to the TDF barriers that I described to you. So how does this work? And again, I'll very briefly show you, it's an Excel tool. It's called the CFIR ERIC matching tool, and it's really cool. So this was developed from input of 169 experts in implementation and people with familiarity with CFIR, and they were asked to actually look at all of the CFIR barriers and then rank up to 7 strategies from the ERIC tool that could be addressed by each. And so the picture you see on the left-hand side is that Excel file where you actually go through it, and for each barrier, you can identify 0 for this barrier is not relevant to me, and 1, yes, this is one of the barriers that we identified as for our project. And what that does is then it indicates if the CFIR construct barrier is there or not, and it generates an output of the strategies that can address each barrier. So taking a closer look at this, and again, apologies, this is very small, but all I want you to take away from that is then in this Excel file, you see the list of the ERIC strategies on the left, and then you see the actual barriers, the CFIR barriers at the top. And then anything in the green highlight means that those are the strategies that you should want to consider for your strategy. So for example, the ERIC strategy of identify and prepare champions is a strategy that could address a challenge that was in that one domain called formally appointed internal implementation leaders. So there is a barrier within that particular construct that this identifying and preparing champions could address. And similarly with the other ones where I've highlighted in red there are the strategies that could address challenges within those CFIR barrier constructs. So really all I'm trying to show you here that this tool kind of automates this process where you just map out your barriers, and then it gives you an output that shows you the type of strategies that you can consider to address your barriers. So let's move on to the evaluation frameworks, and this is the last one. So this is the last one from this framework. And so evaluation frameworks really helps us to understand, explain, or assess the influences of innovation, program, tool, or whatever it is that you're trying to do. And it really helps guide the planning of the evaluation, to specify aspects of the evaluation, to determine implementation success, And it also helps you to select appropriate implementation and evaluation outcomes. And again, there's a list of TMFs that you can consider. And now I'm sure that you can see some of the overlap of those TMFs with some of the other purpose categories in the determinant frameworks. And so I just wanted to give you very quickly, because I'm looking at the time as well. I want to make sure that there's enough time for questions. One example of an evaluation framework is the REAIM framework. So this stands for Reach, Effectiveness, Adoption, Maintenance. And as you can see on the left-hand side, those are all the 5 domains of REAIM. And it's really intended to facilitate the sustainable translation of knowledge into practice. Those 5 domains help you with planning and evaluation of an implementation of an innovation. And you can select your outcomes, and you can also collect and analyze and implement data, and you can also create other knowledge outputs from this framework. It's quite useful. And one of the neat things about REAIM is it has a lot of existing resources and guidance. This again is just a resource slide for you that shows the REAIM dimension, the related questions you can ask from your team to figure things out, how you're gonna, what level it's at, measurements you can consider, the influencing factors and improvement strategies. So it's a really useful mapping tool to help you figure out what it is you want to use this for. It also has a really great web tool. I put in the access to this up here that you could try, which is really amazing. And just as just an example of how we used it in our program as a way of developing key evaluation questions as part of the work that we've done for the training and mentoring program of the Diabetes Action Canada Research Network. A second example, again, this was related to the trial that we did to evaluate the KeepWell tool that I described earlier. And we used REAIM as a way of coming up with our outcomes. So the reach outcomes, the effectiveness outcomes, adoption, implementation, maintenance. And so it's a very useful tool and one of many evaluation tools that you can use. And the last part of this presentation is really very quickly to kind of walk you through when we might be able to use theories, models, and frameworks. So the best way of describing this in my mind is just to think through the research process pathway. So we all, when we do research, we have this exploration stage, the planning stage, the execution, processing, as well as the knowledge mobilization. So thinking through that, like what do we do when we're exploring? That's when we're thinking about objectives, research questions. That's when we might synthesize or combine research evidence on a particular topic, or to figure out what knowledge are we missing? What do we need to consider? And there's a series of process as well as determinant frameworks that you can consider for this exploration piece. And again, I'm not going to go through that again. I just described most of them, but here's a list a select list of what you can consider. In terms of planning, this is all about actually discussing and finalizing those objectives, research questions, developing a knowledge mobilization plan. So as you can see, I deliberately put this in here because planning your knowledge mobilization should happen at the beginning, at the planning stage, not at the end. You execute the plan at the end, but the actual planning should happen right at the beginning. So, and again, here we list the different theories, models, and frameworks across process and determinant frameworks to help with planning. Executing is when you actually develop your data gathering tools that I described earlier. This is when you're collecting your data. This is when you're actually carrying out the study. And again, some of the TMFs that you can consider there across process and determinant frameworks. Processing is all about synthesizing or analyzing your data and interpreting your data. And again, some TMFs that you can consider. And then, of course, knowledge mobilization. And this is where you would execute that plan that you put your plan into action of what you've planned before. And some of the TMFs that you can consider is I think related to the evaluation of the effectiveness of that knowledge mobilization plan. So once we've executed that plan, how well did it work? Did we reach the audience groups that we had planned to reach? And so again, you can consider theories, models, and frameworks to actually help you do that. So then lastly, I wanted to just iterate that integrated KT or co-production of knowledge is a very important part that crosses over to all of these different activities within this research pathway. So integrated KT, again, apologies for the spelling, and we used a search and replace function, and so it messed things up a little bit, but when we circulate the slides, we'll correct those. So integrated knowledge translation or co-production of knowledge is a very important piece, and it's very relevant at every stage of the research pathway. And the idea is to involve all of those different knowledge users in all of these different pathway steps to make sure that that we get the research that's the most relevant and useful for them. There are some TMFs that are related to the practice of integrated KT or co-production of knowledge that I've listed here. Again, it's not an exhaustive list. And another final piece that I want to mention with this is that evaluation of your IKT team effectiveness, the way the team functions, is also very important. And you can use some evaluation frameworks for that purpose as well. And finally, I just wanted to highlight some references here. And again, it's not an exhaustive list, but as many of the references that I used throughout the presentation. And hope you found this helpful, and happy to take any questions that you have. And we also included the QR code there for a brief evaluation survey if you get a chance. That would be amazing, so that we can improve the way we deliver these webinars as well. So thank you so much for your attention, and happy to take any questions.
That's great. Thank you so much, Monica. It's a great presentation. So as Monica mentioned, we've entered the Q&A period. So please feel free to raise your hand or type your question in the chat. I've also sent the survey link in the chat, and I see that Taja's got a question. So Taja, please go ahead.
Hi, Monica, and hi, Julie. It's Monica for the presentation. My question is, when you get a request from someone with a problem, what's your sort of first go-to or instinct in terms of determining what kind of tool or what framework you would use to address the problem?
Yeah, great question, Taja. So I think the most important thing is to understand what the objectives are of the research, what the team is, the scope of the project, even identifying if you have the right team members around the table to be able to do the research. And once we have that clarity, then we systematically follow through that framework that I showed about trying to answer one of those three questions. So understanding the project, the team, the scope, and the purpose of any sort of knowledge mobilization or implementation work that will accompany the research project is a very good first step to that.
Great, thank you.
Thanks, Taja. Thanks, Monica. Any other questions? Feel free to type them in the chat or raise your hand. We welcome any and all questions. Monica, perhaps while we're waiting, I can ask you a question. So you mentioned early on, I think when you were describing the process models, about theories and the difference between the theories and a process model, and you gave the example of the diffusion of innovations theories. Could you maybe explain a little bit more about theories, what they are, and when or how you would use them?
Yeah, so I think the theories are more explanatory. So when I described how the diffusion of innovation theory is it doesn't actually deliberately cause change. It's because it just explains how things work, but it doesn't actually tell you what to do. And that's the biggest difference. So theories don't actually tell you what to do. They don't provide a process or the steps in actually doing. And that's what you really need to be able to deliberately cause change. You need those steps. You need a framework or a model to be able to do that. So that's the big difference between the two.
That's great. Thank you. Any other questions? Perhaps everybody's filling out the survey. It's a very short survey, so we would appreciate everyone, if you could, to take the time to complete the survey. Included the link in the chat. Any other questions? No. I think perhaps, Monica, you did a really good job explaining everything. And I think there's a lot of excellent resources in your slides. And as we've mentioned, we will be making the slides available and the recording of the webinar as well. And so we'll be sending those out shortly after today's webinar. So perhaps I'll do a final call for questions. Final call. Oh, there we go. So it looks like, oh, we've got a comment here from Tracy. Excellent talk. Thanks for putting this all together. Thanks so much, Tracy.
Thanks, Tracy.
And I just want to say, I think that everything was so well described, and it's a lot of information for us to figure out what to do next with. And I think that's one of the big questions that comes in when you have such a complex topic like knowledge mobilization, about understanding what comes next. And especially people who are new to the science and the application of this type of science. So it was very well delivered, and thank you very much for it.
Thanks so much. Thanks so much, Tracy. And I just wanted to add too that that's one of the purpose of the Knowledge Mobilization and Implementation Science program at Diabetes Action Canada is exactly to try and build more capacity and understanding around knowledge mobilization, all of these complex topics and areas, but how we can simplify them, because we can break them down into usable parts that can then help with research. So, but there's a lot of different areas. We could do a whole session just on one area. So we hope to do other webinars in a near future to dig a little deeper into other aspects.
Mhm. Okay, great. So I think on that note, I think we will conclude, and everybody gets 10 minutes back in their schedule. Thank you so much.
Great.
And if anybody would, like to reach out or connect with Monica and myself, please feel free to do so at any time. All right. Thanks so much, everyone.